Hi there everyone, welcome to this brief slide presentation about Cushing syndrome. I just thought it would be helpful at this point in the project to sort of provide some visual aids with some commentary on them to sort of help as we walk through Cushing syndrome in some more detail. So before we get into the signs and symptoms and the diagnosis and the treatment, I thought it would be helpful to provide this visual aid to you as we talk about the pathogenesis of Cushing's. So I already had briefly talked before about what can cause Cushing syndrome. So then, that being said, it's a little bit confusing. So I figured it might be helpful to first take a look at what happens when the endocrine system is functioning correctly in terms of secreting the proper hormones at the proper time and ensuring that the feedback mechanisms are working correctly. So, I'll show a brief animation about that. And then after that, I think it might be helpful to sort of give a visual about what happens in these different types of endogenous types of Cushing syndrome. So the exogenous form of Cushing's is brought on by the excessive and chronic use of synthetic glucocorticoids. And then on the flip side, then the other types of Cushing's are brought on by a number of different reasons. So I thought it would be helpful to kind of show visually what's going on with that and what's sort of feeding back into what and so and so. So this first slide here, balance is the key to life. I think it's just really important to keep this in mind when we're talking about endocrine disorders. So the endocrine system is amazing at keeping our body in homeostasis. So making sure that the proper hormones are being secreted or inhibited at the perfect times according to our environments and all this other, stimulation that's happening in our lives. And so it's really important to keep this in mind, that it's such a fine line. And even though our body is amazing at keeping this balance, there are situations that occur that sort of cause this balance to slip. And so that's kind of what I want this presentation to convey. So the next slide will just show you a brief animation of what the hypothalamus, pituitary, and adrenal glands are doing when they're functioning in synchronicity. Okay, so once you watch this video on the next slide, then we'll move on to what it looks like when things go wrong.
The stress response. In stressful situations, the body switches on its autonomic nervous system and neurobiological processes in an attempt to maintain homeostasis. The body is prepared for its reaction to stress. In the brain, the hypothalamus is connected to the pituitary gland. The hypothalamus, stimulated by the sympathetic nervous system, releases the hormone corticotrophin-releasing factor, CRF. The CRF activates the pituitary gland to release the adrenocorticotropic hormone, ACTH. This in turn alerts the adrenal glands. The adrenal glands are located on top of each kidney. The ACTH from the pituitary gland stimulates the adrenal cortex to release cortisol. At the same time, neurons in the hypothalamus signal the medulla to release epinephrine, adrenaline, and norepinephrine, noradrenaline. These hormones then push the body into hyperalertness.
Okay, so I think that animation does a really good job of sort of showing the normal mechanisms that are going on with your hormones in a stress response. So this then visual image here I think is helpful when trying to figure out in the forms of endogenous Cushing syndrome sort of what the mechanisms are looking like in each of those scenarios. So scenario A is when things are going right. So as you saw in that animation, the hypothalamus releases CRH or CRF to the which then signals to the pituitary to release ACTH, which then signals the adrenals to release cortisol. Cortisol then feeds back so that CRH and ACTH production stops. So in scenario B then, this is Cushing's disease, which is a cause of endogenous Cushing syndrome. And the problem is with the pituitary gland. It's a pituitary tumor that secretes high levels of ACTH. So this secretion of ACTH is signaling the adrenal glands to secrete cortisol. So even though the body's not in a stress response, you're seeing high levels of cortisol in this situation. In scenario C, the problem is with the adrenals. You can see that small red dot there signifies an adenoma, which is a benign tumor, but in Cushing's they're functioning, so they're releasing hormones. So this adenoma is releasing high levels of cortisol, which is then telling the hypothalamus that CRH is not needed, so ACTH production is downregulated in this situation. In scenario D, this is the least likely cause of Cushing's, and it's a carcinoma in the lung. And this carcinoma is secreting ACTH, so ACTH levels are going to be high in this case. ACTH is then telling the adrenal gland to release high levels of cortisol. So ACTH and cortisol will be high in that scenario. So I think that's helpful to just kind of take a look and be able to really visualize what's going on in these different types of Cushing's and which hormones are high or low or inhibited or being secreted. So now that that's out of the way, we can move on toward the signs and symptoms of Cushing's.